let's talk about the pros and cons of getting a cortisone injection if you're someone suffering with shoulder pain. My name is Huang. I'm an occupational therapist and certified hand therapist. And at my clinic in Miami, Florida, hands-on therapy services, I get this question a lot. Like, should I do it? Should I not do it? So let's just discuss this so you can make an informed decision on your own. So much of it just depends on the particular type of shoulder pain that you have, because though you might read on Google or even AI now, it's just telling you a lot of generic information about what cortisone injection is. Cortisone injections are pretty much a medication that they put right inside wherever you have the pain. Most of the time it works on tendonitis types of issues, like you have inflammation around your tendon. So my question always is like, why do you have inflammation there? Because if you know why you have inflammation there, it could help you to figure out like what you need to do. So let's go over the pros and cons of cortisone injections for the shoulder. And I wanted to talk about it because I often talk a lot about not doing injections if you're somebody who wants to avoid it and that kind of stuff. And that's just because in my clinic, we have a tendency to see a lot of people who are looking to avoid the injections. Injections are like little pills, right? It's easy to pop a pill. It's easy to go ahead and get a cortisone injection. But let's figure out if it's good for you or not, all right? So here's when cortisone injections can be really good for you. Cortisone injections can be used as a diagnostic tool for any kind of shoulder issues. And what they do with that is they're going to rule in and rule out a problem. You just can't see everything in an MRI or an X-ray. Your shoulder, in every part of your body, there's a purpose for the structures that kind of hold everything together. And you can't see everything in an MRI. You can't see everything in an X-ray. X-rays just show bone. They show the congruency of bone, like how smooth your bone is. X-rays show where your bones sit relative to somewhere else. And so if there's no gap, or there's too much of a gap, or it's like over on this side and the other bones on this side, then like, hey, your bones are not sitting where they're supposed to sit, right? MRIs show soft tissue. So MRIs will show like, hey, you have a lot of inflammation in this particular area. And so usually with MRIs, you'll look for like, hey, do I have a ligament tear in my shoulder? It's called your labrum. Hey, do I have a rotator cuff tear in my shoulder? And it's, usually one of the 4 rotator cuff muscles, the supraspinatus being the most common tendon of the shoulder that is torn. And so when they decide to use cortisone injection to put in, they're usually going into a particular space in between tissue, in between bones, to see if like, hey, if we put this medicine there, will it go away? If your pain goes away, then hey, hallelujah, that was the problem. If it doesn't go away, then that's not where the problem is. And so maybe we need to come up with another solution. So shoulder problems isn't so cut as dry as like, do this one exercise, get this one cortisone injection, and that's the end all be all. There's a lot of different problems that your doctor, your therapist, they're helping you to rule in and rule out. Right? If you can rule in, if you can rule out, first of all, most things, then you can rule in the one particular problem that you have, so that it helps you get to fixing it correctly. You just can't chuck shit at the wall and be like, oh, let's see if that works. So if your doctor is recommending cortisone injection, find out if they're using it as a diagnostic tool. You should go to your doctor or your therapist with some questions. This was one of the questions that someone came to me with, so I wanted to share it with you. So it's a diagnostic tool, number 1. So it can be really good to use if that's what we're using it for. Number 2, if you have an acute pain, meaning it's very strong in a very particular spot. Cortisone injection is not so helpful if it's like I feel it all over the place. Cortisone is like, I feel the pain here. And so when you show your doctor, your therapist, very specific pinpoint pain, meaning it's in one major spot, it helps them to, like, it helps me to visualize where the shoulder is and why you might have that. We also have what's called referred pain. So sometimes just by telling your therapist or doctor exactly where that pain is, it helps them to think, oh, is the pain coming from the shoulder or is it coming from somewhere else? Referred pain is, one of the ways that as a healthcare professional, we're looking to rule in and rule out particular problems, right? So acute pain, meaning severe pain, and when you use a cortisone injection, it can help because it can reduce the pain enough for you to make any therapy intervention more beneficial, right? So if you're coming in, your pain is like 8 out of 10, 10 out of 10, and it's been there for months and it's like nothing is really going away, cortisone injection might be a really great option for you so that you can then have the pain reduced so you can tolerate the therapy that you're looking to do to avoid surgery, or you might not even be a candidate for surgery, so therapy is really your only conservative option. So it can be really good for that. The other thing that is used for, I think it's used for the last and only option is when you are not a candidate for surgery, right? So for some people, maybe they have other health risks and they can't have surgery, or it's just too dangerous for them to have surgery. So a doctor will offer a cortisone injection because it at least relieves a certain amount of pain for a short period of time. Now, the general rule of cortisone injections are you're not supposed to have more than 3 to one particular area. So they're not going to do like 5 shots of cortisone to your shoulder over a period of time. Like they're, you know what I mean? So the general rule of thumb is you don't want to do more than 3 shots to one particular area. Now, there are going to be some people who that rule gets chucked out the window, right? I had a patient, she had really severe arthritis, and she had it in major joints of her body. So she had bilateral knee replacements, and they, when you do knee replacements, if your shoulder were not that great to begin with, it then relies on a ton of upper body shoulder strength to push yourself around, to walk and to get yourself up and down. And and your shoulders, very specifically your shoulder, you have a lot of wear and tear in your shoulder, especially after the age of 40. And so she suffered from rotator cuff tears, and she had been living for a long time. I guess she had made decisions in her youth, like when I met her, she was like, 75 or 80. But when she was much younger, she decided not to do anything with her shoulders from what I understand. And she had developed severe arthritis. Her rotator cuff tendons were really torn, and she was really in a position where she needed a total shoulder replacement. And she just wasn't in a position health-wise to have this major surgery. And then she didn't want it, and it was on both sides, and she was just like, I'm just gonna live with it. And so someone like that, she would benefit from repetitive cortisone injections just for pain relief, just because the side effect. Now we're going to go into the cons of cortisone injections. Cortisone injections, the medication essentially wears down your soft tissue, wears down your tendons, and so it's degenerative to the tendons. And so, she didn't really have any good tendons, so they were like, well, that's shot, so we can give it to her, right? But just know, if you don't have like shitty tendons, you would be cautious to do more than 3 in one particular area. And most surgeons, they, you should ask them why they're offering, if they're offering more than that, right? So yeah, my patients, they ask me, like when they'll come in, they don't always tell me like, hey, I had cortisone injections, and then I'll ask them, and then eventually be like, oh yeah, I already had one and it didn't work. That's why I'm seeking therapy. So, just keep it in mind, like the cortisone injections, they do deteriorate the tendons and the ligaments to a certain extent over a period of time if it's overused. So that's one of the cons. That's one of the reasons why people don't want to do repetitive injections to one particular area. Cortisone injections also temporarily increase your blood sugar. So if you're someone with diabetes, cortisone injections, what it does is it goes to one particular area, which is good, versus taking pills and it has to go through your stomach and then work out into your system. The medication goes directly to the spot and fixes it. But like any other medication, there's side effects to it. One of the side effects is temporary increase in your blood sugar and can also affect your blood pressure. And so if you're